Interface introduction.
This is our interface. We can see this is the energy value, frequency and wavelength. When the wavelength is 1064 nanometer, the energy is 100 to 600 mJ. When we change the wavelength to 532 nanometer, then the energy is 100 mJ to 300 mJ. The counter means how many shots you emit. The work mode includes 3 modes: single pulse, double pulse, and long pulse for your options. The fluence means energy density and the spot size. And we can change the spot size here. Just put it a little bit up and turn around like this. And then the spot size is 5 millimeter, and this is also the 5 millimeter, 4 millimeter, and 4 millimeter.
Mouse, tattoo remover.
These are the items we prepared: cotton swabs, spatula, anesthetics, saline, povidone-iodine, gloves, gauze, alcohol pad, mask, goggle, eye shade, and ice pack. Now the doctor is applying anesthetics on the patient's face, and then put the plastic film on the face. Patient preparation: be informed of the contraindications, sign the consent form, be informed of the post-operative precautions and possible conditions.
In 30 minutes.
Now the doctor is removing the anesthetics and do the clean work, cleaning the face again. The doctor is taking photo of the patient. After doing the clean work, the doctor should take photos. We recommend use skin analyzer to take photos. The doctor is disinfecting and cleaning the treatment area. Before treatment, the doctor is doing sensitiveness testing. The handpiece is vertical to the target area. The handpiece is gently attached to the skin. Another hand helps flatten the wrinkles on the skin, such as deep wrinkles. An E-dermal reaction or immediate whitening is considered the endpoint reaction. Low frequency is recommended for mole. High frequency can be chosen for tattoo. For colorful tattoo treatment, after 2 months of recovery, if the color of the tattoo remains colorful, using the last handpiece again to do treatment. If the color turns gray and black, scan with the 1064 nanometer handpiece. Treating the thin skin of the parts, such as the forehead, can slightly reduce energy. After the treatment, use mask to hydrate, cool, and smooth the skin. Uses mask to hydrate, cool, and smooth the skin. At last, apply thin growth factor or antibiotic ointment.
Carbon PUE.
These are the items we prepared: cotton swabs, carbon brush, saline, gloves, gauze, alcohol pad, mask, goggle, eye shade, and ice pack. Patient preparation: be informed of the contraindications, sign the consent form, be informed of the post-operative precautions and possible conditions. Now the doctor is applying carbon on the patient's face. Covering skin is suitable and avoid too thick. Wait 5 to 10 minutes for dryness. It's wearing eye shade for the patient. It's wearing goggle. Adjusting parameters. Now the doctor is doing energy testing. The handpiece is vertical to the target area. There is a small overlap between the light spots to avoid missing. Always keep the handpiece from the skin within about 3 to 5 centimeters. The patient will feel slight needle prick on the face. The order is from inside to outside, from bottom to top. Placing the cotton 2 to 3 times. The skin is slightly red and warm. Another hand helps flatten the wrinkles on the skin, such as deep wrinkles. The doctor should keep communicating with the patient to adjust the energy. The doctor is cleaning up the carbon on handpiece in time. After the treatment, clean the face again. The carbon and the dirt in the pores become tiny particles, and some residues will come out with the metabolism. After the treatment, use mask to hydrate, cool, and smooth the skin. After the treatment, the doctor uses mask to hydrate, cool, and smooth the skin.
Thin rejuvenation.
Items preparation: cotton swabs, saline, gloves, gauze, mask, goggle, eye shade, and ice bag. Patient preparation: be informed of the contraindications. Sign the consent form. Be informed of the post-operative precautions and possible conditions. During the treatment, the patient will feel warm and a slight needling feeling on the face. At the beginning, the doctor used large spot size and low energy to treat the patient and then changed to long pulse. Another hand have flattened the wrinkles on the skin, such as deep wrinkles. Handpiece is vertical to the skin surface. Always keep the handpiece with the skin within about 3 to 5 cm. Vertically or circle scan from bottom to top, from inside to outside. A slightly red skin or warm feeling is the treatment endpoint. Scanning the whole face for 1 to 3 times. After the treatment, use mask to hydrate, cool, and smooth the skin. The doctor uses mask to hydrate, cool, and smooth the skin.